Good evening. I'm Lou Goldstein with Chris Grant, and welcome to part two in our conversation with Dr. Eddy Bresnitz, who is the Senior Medical Advisor to the Commissioner of Health at the New Jersey Department of Health. Last week, we covered a lot of topics about COVID and the various shots that have been put out by Moderna, Pfizer, Johnson & Johnson, and other companies, as well as what this means in the long run, both now and down the road to the population as we try to get through this pandemic and develop herd immunity. So first, Dr. Bresnitz, thank you very much for coming back on for a second time. And we thank you, and hopefully we'll have a great discussion. So I'm going to turn it over to Chris, and we'll start part two of our interview with Dr. Eddy Bresnitz.
Yes, thanks, Lou, and welcome again, Dr. Bresnitz. Dr. Bresnitz is, as Lou said, the medical advisor to the Commissioner of Health and actually the Governor's office on the state response for COVID-19. He brings decades worth of experience both at in New Jersey, nationally and internationally, trained in medicine at McGill, and subsequently he became a professor and chairman of the Department of Community and Preventive Medicine. He is multiply certified in the boards of internal medicine, pulmonology, preventive medicine. And on top of that, he's just a great guy who thinks very much about the impact of big social public health programs on individuals. So we're delighted he's here today. And what I'd like to do, just very briefly, we started, we've already gone through the fact that in New Jersey, we have had over 600,000 cases of COVID-19 since last January, actually, when the very first January, February, approaching 20,000 deaths. At this time, in the midst of winter, we are approaching about 3,000 current hospitalizations, but that's actually a better position we were in. So we talked a little bit about the aspirational milestones, given the fact that the vaccine's starting to roll out. And we hope generally, as the winter, spring, summer, and perhaps into fall progresses, at least 70% of New Jersey's eligible candidates for the vaccine will be immunized. And so that was important to hear. Please stay tuned, because today we will be talking again about the current information about vaccine distribution and access and some special impacts. So I did want to really talk about, in the context of what is going on, New Jersey remains the most diverse state in the Union in terms of racially, ethnically, in many ways. We are a wonderfully diverse state. But with that comes sometimes unequal access and information and utilization of services. And I know that is a particular concern to the state today about how to make sure that not only the information, but access to services are available to individuals of color, of many different ethnic and language backgrounds. Could you comment maybe in the context of both access to care, but also vaccine access?
Yeah, so way back when we started planning for the eventuality of having vaccines, and the planning began literally last spring. The CDC reached out to the states and developed some guidance for the states to begin that planning process. You imagine last April is when we began. And there was a recognition that we might or might not have vaccines, but we were hoping for the best and planning for the best. And it was clear that that there were many vaccine candidates that were in the developmental pipeline, but we didn't know which ones were going to get to the finish line first, and in what order and what time frame. But what we did know was that whenever that first vaccine or vaccines became available, there wouldn't be enough for the country, and certainly not for any one state, including New Jersey. So, and this was a recognition, not just the folks in New Jersey, but at the national level as well. And there were several meetings of advisory groups at the national level The National Academy of Sciences developed a framework for the equitable distribution of vaccine. Johns Hopkins University actually was the first sort of organization that developed ethical guidelines for distribution, for allocation and distribution of vaccines. Then the Advisory Committee on Immunization Practices, the ACIP, that advises the CDC, developed its recommendations for phasing in the vaccines in the context of scarcity of the vaccines. And then within New Jersey, we have a multidisciplinary, diverse professional advisory committee that I chair, which consists of about 28 folks from a variety of disciplines, healthcare, leadership of organizations, medical society, nursing society, hospital association. We have CEOs of large hospital, and I'm not going to say change, but integrated networks. We have a lawyer, we have ethicists, and so on. Again, making recommendations based on these existing recommendations at the national level that informed our own deliberations. And based on those, we made recommendations on phase 1A, 1B, and 1C, and phase 2, all basically geared in the context of increasing availability of vaccines. Now, and they were all based on ethical principles in sort of overarching goals of preventing morbidity and mortality, being transparent about those recommendations, and also achieving equity. And one of the things that we recommended initially was, as we move forward through the allocation distribution process, that we do our best to look at indices of social vulnerability, looking at where people might be living who are more highly vulnerable to, or have a higher concentration of individuals who have a higher prevalence of chronic diseases, who have people who are socioeconomically deprived, people who have housing issues, people who have transportation issues, and so on. And we are more and more looking at that now, not just in New Jersey, but around the country. I'm sure that you've been reading articles where throughout the country that the populations or communities with people of color are not getting vaccinated at the level that we would like them to be, certainly not reflecting the percentage of the population that they, sorry, you're gonna have to edit this. We're seeing a lot of disease in communities with people of color, much higher than the white population. And we're trying to basically, as best as we can, give opportunities or make opportunities for those communities to have access to the vaccines as we move forward, because we're just not seeing enough of them being vaccinated at this point in time. Now, there are a lot of reasons for that, and some of them have to do with historic reasons, with distrust in the community. Some have to do with access. Some have to do with people basically having better access through internet, or better skills with getting on the internet and snagging a reservation. I mean, there are lots of reasons why we have an imbalance of who's getting vaccinated right now within New Jersey and in the country as well. Did you want to say something?
No, go ahead.
So I mentioned the various phases. 1A, which was true for most parts of the country, the target population was healthcare workers. And in New Jersey, it was healthcare workers, whether they were paid or unpaid, whether they lived in New Jersey, whether they only worked in New Jersey. We included, as I said, unpaid, so that could include medical students, volunteers in hospital settings. And the other large segment of 1A was congregate settings, such as long-term care facilities, institutions for the developmentally disabled, prisoners in prisons, situations where people were, basically unable to live outside of a facility where there was, not people, sorry, maybe I'm getting a little tired here. The 1A included people in congregate settings where they were unable to basically live on their own. And so they were basically living with other people for one reason or another. And we know that from the epidemiology that those populations had a high incidence of disease, significant mortality, particularly in the long-term care facility and assisted living facilities. And so those is the 1A population. The 1B population, the recommendation was a variety of sectors of essential frontline workers, including law enforcement and fire professionals. And that was the next group that was basically made eligible to get vaccinated, and they had been vaccinated. And in addition, there was another group in 1C that consisted of people over the age of 65, and those between the ages of 16 and 64 who had underlying chronic conditions. We initially had people over 75 in this 1B category, but the governor made the policy decision to basically expand those who are eligible in the 1B population to those two groups, those over 65, which obviously included those over 75, and those people 16 to 64 who had underlying chronic medical conditions as defined by the CDC as being at higher risk or maybe at higher risk for developing COVID-19 and sustaining the adverse events of having those illnesses. Amongst those populations, you had a lot of people who were from communities of color with higher prevalence of conditions and higher morbidity and mortality as well. So we're still pretty early in the vaccination program or campaign. We started them in December. It's now early February. This campaign is going on for many more months. And as we move forward, we're going to get better and better at targeting the vaccines to those more vulnerable populations. But it's going to take time. We have some programs in place where we're doing that. We're thinking about having mobile vans going to communities where access may be difficult. We're having pop-up sites where, you know, sort of not maybe one time, but sort of temporary sites where we can get people in those communities to walk to the sites as opposed to having to have transportation. And we're targeting those communities based on our analysis of where those vulnerable communities are within the state.
Thank you.
One of the big questions also is a mental health question. We've been basically under house arrest and safety protocols now for a year. People are getting used to going to work in the blue jeans and sweatpants, and not getting dressed up to go to work because they're doing remote learning. But they've been in quarantine or in isolation for the better part of a year, and there's 72 million young adults and millennials who were born between 81 and 96, which exceeds the baby boomer in number, and they're tired right now. Their mental health, they're struggling. They're missing the basics. The hugging, the smiling, the touching. Being close to one another. And there's places they can't go. So, what advice and encouragement would you give them to stay strong, to keep their minds healthy, and to know that the future is a little bit brighter than the past?
Yeah, well, let me just say that the mental health aspects of this pandemic has affected every segment of our society. And I would start with the health professionals that have had to be on the front lines taking care of people who've had COVID-19. I've seen so many moving testimonials of healthcare workers who day in and day out have had to go to work, voluntarily go to work, and deal with unprecedented numbers of people dying on a daily basis. It's brought me literally to tears on some of these testimonials that I've seen in the media. And that's still ongoing and has been for a year. I haven't seen patients in a long time. And the thought of actually doing this day in and out, week after week, month after month, it's just difficult to even imagine. So that's and clearly these tough people who in the past have worked in ICUs and dealt with death and very sick people on a regular basis, they're all are not immune to what's been going on, and so it's been very difficult. They've watched even friends and co-workers who've become sick and died as well. So that's kind of the first frontline groups. And then we have, people who, because of the economic impact of the pandemic, wage earners who've lost their jobs, who are, have been living no savings, living hand to mouth, now having to rely on, handouts, if you will, or unemployment insurance, not knowing when those benefits might run out as well. And so that takes a toll on the public who are not working. Then you have people who are working as frontline workers, people who in the food industries, people who are in public transportation and so on, where they've also seen many of their coworkers, for a variety of reasons, get sick, maybe because they've been exposed in their communities, but maybe they've been exposed during their occupation. And we know that, in fact, there were lots of occupational safety and health issues that weren't very much enforced over the last year of the pandemic with the last administration. So, so those people have had tremendous mental health impact. And then, of course, the impact on the general public of having to stay home and do all those non-pharmaceutical interventions that I mentioned last week, which, to reiterate, included constant masking, constant vigilance about not coming into contact with people who are unprotected, avoiding congregate settings, avoiding gatherings, washing your hands, all those things when you're not normally doing that, they take their toll as well. And then again, not getting together with people on a social basis, which people normally will do, some more than others. And then there's the impact on people who have comorbid conditions, or older, or people have previous mental health issues. Even those who are, do not normally have mental health issues, or at least deal with them on a day-to-day basis without any issues, they certainly have become vulnerable, but those with pre-existing mental health issues are even more vulnerable. And so, I just read an article today about, or yesterday, about people with schizophrenia basically having a higher morbidity and mortality because of COVID-19. Now, that's strictly a mental health issue. It's not an underlying medical condition. It's a mental health condition, and yet they have increased morbidity and mortality because they may not be able to get to the healthcare that they need, the medical healthcare that they need when they do get sick. And maybe they have a hard time understanding how to basically practice those measures where their infection risk is reduced. So we have that component of it. We have people staying at home with their family members where they normally don't spend 24/7 with them, living perhaps in a very small physical household, 1 room, 2 rooms. Now, not with 1 or 2 people, but with 5 or 6 people. And I think you can understand that that's not a good situation, even when you don't have mental health issues. And that could raise to more abuse in the household, both physical abuse and sexual abuse as well. We've been reading about those issues as well. And then the children, children who at all ages who can't go to school anymore, or I shouldn't say they can't go to school, but they're doing all their learning online if they're older, or they have some hybrid situation where they no longer can socialize with other children or adolescents of their own age, which is an important element of growing up for all children. And of course, that begins to take its toll as well. And we've heard that, in fact, there is an increasing use of or increased incidence of psychiatric issues amongst these children that require their seeking help and medical care. So there's lots and lots of evidence that, in fact, this pandemic is basically having an impact, not just on physical health, but on mental health as well. And so the sooner we can get out of this situation and get back to whatever our new normal is going to be, the better it is. And thankfully, we now have these vaccines, as I've talked about last week, that are going to go a long way to getting us back to where these issues, not that they're going to go away, but there's less of them, they're less frequent, and they'll be easier to deal with.
In the couple minutes we have remaining, Eddy, could you talk briefly about the issue of vaccine hesitancy? I think most people understand what it is, and it's not unique to COVID-19 vaccines. But what is the range of what you're seeing? I must admit, I heard recently about women of childbearing age, including a group of nurses who have opted not to take the vaccine. And that was, you and I have worked in this field for many years. That's not unknown, but the amount of people who otherwise would have training and information surprised me. So what is the approach that you think public health and all of us should be taking to listen to, but encourage people to consider vaccination seriously?
Well, vaccine hesitancy is two words, but it really represents a heterogeneous group of people. And it's not one concept, although we label it as, make it seem like it's one concept. But there's a range, and the range is from people who are not hesitant at all. You just have to show them the data, and they say, how soon can I get vaccinated? Because they believe in vaccines, they understand the science, they understand that it can prevent illness and morbidity. It has a benefit not only for the individual who's been vaccinated, but for their family and friends by protecting transmitting of the infection and their community as well. So those people, that's one end of the spectrum. The other end of the spectrum is people who never get vaccinated and frankly never will get vaccinated. There's nothing you can say to those people that will convince them that vaccines are preventive in nature, that the benefits far outweigh any harm they might think can accrue to the vaccines. And so those are individuals that really it's almost impossible to provide the right information or the right message to those individuals to convince them that this is in their interest, in their community, and their family's interest. And then there's the large segment in the middle that have varying degrees of hesitancy. And the reasons for that hesitancy varies by individual based on who they are, what their education level is, what their race and ethnicity might be because of previous experience, personal experience in getting vaccinated, family experience, internet myths that they might read, and so on. And you really can't, pinpoint or say what message will actually resonate with an individual who has some level of vaccine efficacy. I mean, there are some generalizations that you can make, but you really have to understand, or when I say you, I mean the public health officials, government officials, health providers who are doing whatever they can to get people to accept the vaccine, understand that they have to have the right message for the right people at the right time, given by the right people. And the message is not a one-time event. It's really something that has to be given over and over. You have to think about moving people along the hesitancy spectrum from being relatively unwilling to get vaccinated, not refusing, but unwilling to get vaccinated. And depending on where they are and how quickly they can absorb whatever messages that you're providing to them, move them along the spectrum with time, understanding it takes time for some of them to get to the point where they're willing to accept the fact that the benefits of the vaccine outweigh the risk.
It's a good point. I think there's a little bit of frustration right now too, with people trying to get appointments, but hopefully the supply that's coming in hopefully will resolve that.
Well, supply isn't clearly a factor when it comes to hesitancy, but supply, because right now there's clearly not enough supply to meet the demand. So all those people on the side of the spectrum that have no hesitancy getting vaccinated, we got plenty of those people, millions of those people who would like to get vaccinated. We don't have to talk to them about, the factors why they should get it. They know they want to get it. That's not fair. Yeah. And unfortunately, as I said, I don't know if it was this segment or the earlier segment, it was actually earlier on, I said we knew in the beginning that there would be a scarcity of supply. And so that was the purpose of the phases, and sort of to try to structure it so that we would, in a way, control demand by saying, if you fell into this segment, would you be eligible? And then over time, as more and more vaccine became available. Now, it quickly expanded with the changes in those who are eligible. So right now, We've had over 4 million people in New Jersey who were eligible based on the phases and the policy in the state. And so far, we've had maybe 1,300,000 doses of them that have been allocated to the state. They all haven't necessarily arrived. We have about, or getting close to 1 million people who've gotten vaccinated, well, not vaccinated, but 1 million doses that have been given out, with a significant number getting both doses. Next month, we may, or even at the end of this month, we're in February, we may see another vaccine come on board and be available. And then in a couple of months, maybe even 1 or 2 other vaccines. And once we begin to expand the supply, we'll be able to meet the demand. You know, I mentioned how many people were eligible. We're not trying to distinguish those who are eligible one from another. So for example, if you're 65 and over and otherwise are healthy, or if you're 50 and otherwise have an underlying chronic disease, such as cancer, such as diabetes, such as heart disease, we're not saying that this one person who fits in one category is more eligible or should be at the front of the line of the other person. I think that's too difficult to do. That's not something that the Professional Advisory Committee would tackle. I think it's very difficult. It's a judgmental call. Who's more deserving of the vaccine than others. And so I don't think the CDC and the ACIP never went that granular either. I think it's hard to do something like that. And I can tell you that we're getting, you can imagine, lots and lots of emails and letters, the governor's office getting as well, why this person or that person or this group or that group should be, in this phase versus that phase. And it's almost impossible to satisfy everybody. We went into this knowing not everybody was going to be happy with whatever we did. But that's the nature of government.
Need to have more conversations like this. So thank you. And I think Lou is going to lead us out.
Everybody out there, make sure that you get an appointment and get vaccinated. Wear your mask, social distance, and above all, stay healthy and be safe. So until next week, thank you very much for watching our show. And Dr. Bresnitz, thank you very much for being on tonight. And we wish everybody safe health and good luck in the days ahead. And take care, everybody. We'll see you next week. Have a good night.